myeloid leukemia is a cancer that usually gets worse quickly if it is not treated. It is a most common type of acute leukemia in adults. On this week's episode of the program, Health is Wealth, Dr. Chikadibia Okwoma, a consultant hematologist, will be telling us all we need to know about myeloid leukemia. I am Mariam Abubakar Kana.
Acute leukemia or acute myeloid leukemia is a blood cancer. Cancer forming in the hematopoietic stem cells. That is the cells that actually produce blood cells in the bone marrow. And there are different types. When you talk about these are called leukemias. That's the cancers of the white cells of the blood. The blood has three different types of cells. One is the red blood cell, which makes the blood red. That's one everybody knows. And the second one is the white blood cell, which is the soldiers of the body. They defend the body against infection. And then the third one is the platelets, which prevent us from bleeding when we have cut or when there's an injury. They line up the cut area to prevent bleeding. So most time leukemia is when there's excessive production of the white blood cell due to genetic damage in the gene, the nucleus of the white blood cells, that now causes that mutation now causes that blood to become what we call clonal. The clone means that the same cell that actually multiplying itself. The same type of cell may resemble each other. Maybe when you do a test, you may be able to find out that actually it's only one cell that actually multiplying over and over again. And that process of multiplication tends to suppress the other red blood cell component, like the red blood cell, which carries oxygen and gives us energy, and the platelet. And also because this blood, these white cells that are being produced are defective, so they are not able to do their function, which is actually defending the body from infection. So those are the main things. So if you talk about leukemia generally, if I may illustrate with this chapter, with this paragraph, this chart here, we have the acute leukemias and you have the chronic leukemias. The acute one are those which are very aggressive. They form, and then over between less than 3 to 6 months, they become almost, if it's not treated, the person may die. And they are very, very aggressive. They multiply very fast. And that is where the acute myeloid leukemia comes in. The second part of the acute leukemia is the acute lymphoblastic leukemia, which is part of the lymphoid cells, which originate from the lymphoid part of the white cell. But the acute myeloid leukemia originates from the myeloid cell line, from the most primitive form of the red blood of the hematopoietic stem cell. In that what we call multipotent stem cell. That multipotent cell produces lymphoid lineage and then the myelogenous lineage. The myelogenous lineage to produce red blood cell, produce the white blood cell, and that's the neutrophils, eosinophils, and all the other white blood cell, and the platelet. So if there are defective production in those ones, it's going to affect all those components. Okay, and then is the lymphoid, when it's acute lymphoblastic leukemia, it tends to produce arrive from the lymphoid part. But acute leukemia, myeloid leukemia, is from the abnormality in the myeloid series. They are very aggressive. Acute myeloid leukemia is almost rare. It's not very common, but they are invariably fatal if not treated on time. If not detected and treated on time, they are invariably fatal. Meaning that if not properly, if not diagnosed early on time, and someone who has it within 3 to 6 months, the person may die without treatment. So that is why it is very, very, they are very aggressive. And also the treatment of it is also associated with a lot of issues, because in as much, bear in mind that initially all the blood lineage are affected, they are low. And then even chemotherapy, which we use to treat it, we also tend to damage or suppress might suppress the bone marrow also. So most people who die out of it maybe die because they don't have any cells. That the red cell is not there, or white cell is the platelet is not there, and they might bleed to death. So that's why it is actually is an very aggressive that need to be caught early and treated appropriately. Well, I'll say everybody is at risk. It affects everybody, man to man and woman. But you said it is more common, it's a disease of the old age. It's more common with the elderly. Unlike the lymphoblastic one, acute lymphoblastic one, that is more common with children and younger adults. Okay? But acute myeloid leukemia is commoner with elderly. The median age of diagnosis is about 67 years. But that doesn't mean it also affects children too. But it's more rare in children. Okay? And also talking about those who are more predisposed to getting affected are those who are exposed to factors which have been associated with the disease condition. Things like those who are exposed to high radiation energy. Okay? Those, if you remember, many years ago, we have the Hiroshima, when the atomic bomb exploded in Hiroshima. About 7 years after, many people who survived the bomb blast developed leukemia. Okay? So those who are exposed to high energy radiation, and that's why it's advised people shouldn't build their house under high tension cable, because those also reduce high energy. Those one can also predispose to leukemia. And then those who are exposed to petrochemicals are also likely to develop leukemia. Those who are exposed to benzene, chemical like benzene, even pesticide we use in our farms nowadays, if exposed to a high concentration, can also damage the hemopoietic stem cell, and they produce leukemia. So those are there are also those who are born children who are born with genetic predisposition, like that of Down syndrome, Klinefelter syndrome. Those are genetic predisposition. They are born with those genetic abnormalities, so they are likely also to high propensity to get acute myeloid leukemia. No, I wouldn't say hereditary. It is not really hereditary, but there are those who are born with genetic predisposition, either because they inherited a genetic abnormality in their marrow. Like I was talking about Down syndrome. Down syndrome is a genetically predisposed disease. They are born with that genetic defect. Those that have Bloom syndrome, Klinefelter syndrome, they are all genetic abnormalities affecting those individuals. So that genetic predisposition can now increase susceptibility of more damage to that gene of the hemopoietic stem cell, and thereby lead to leukemia. But being hereditary, that is like saying that my father had leukemia, so I might likely get it, is not so true. So that on that point, I don't know, we say it's hereditary. We have those who are exposed to high radiation energy. Okay, living under high tension cables, or some people have even talked about the phones which you use, even though the phone radiates low energies. But some people are afraid of the overexposure, because you carry this phone on us every day. Some people have 2 or 3 who they carry on their body every day. Some sleep with it. So those are things which are being discouraged, because we don't know the cumulative effect of these low energies on the body. So it's advisable, when you don't need your phone, keep it away. Then we talk about some people have also made about leaving bottled water inside the car and drinking it afterwards, especially in an environment where the heat is so high. It's not advisable. They say it's not advisable to leave bottled water within your car, and then maybe in the evening or so, you now go and pick the water and drink, because likely, like I said, petrochemical rubbers are predisposing factors to having leukemia. So there's theory that with the heating on the bottle, it may release some of those components or chemicals that made up the container, and that might seep into the water, and when you drink it, they have pollution also causing leukemia. Then we're talking about pesticide. Those who are exposed, those are farmers with high, if it's given a high concentration, can also cause leukemia. Well, the symptoms are mainly that of tiredness, weakness, due to reduced red blood cell, anemia. This is present with tiredness, weakness, excessive sweating. Person cannot be able to walk, fast breathing, okay. And then you also have a bleeding because the platelet is also low, so person can bleed and might bleed to death. So may bleed into the brain and may just suffocate on their blood. And then, like I said again, the white blood cells, even though they are in excess, they are being produced so much, but they are not the quality blood cells. They are not quality white blood cells, so they are also not performing their duties. So infection, we have repeated infections, and that's why most people who have leukemia, why they present very late in our environment, is that we keep on treating malaria and typhoid, because those things are what how malaria and typhoid present. You have weak, you are tired, your body is hot all the time, so we keep on treating malaria and typhoid, but unfortunately that may not be what the person has. So the advice is when you are treating this condition like malaria and typhoid and it's not remitting, if you have malaria and you after a day or two the fever should have gone, but when the fever persists, then you should know that there may be something else. They refer to appropriate center where they will be able to take a look. You have treated malaria today, you got better. After a few days again, fever came back again. You treated again, after you came back again. No, you're not dealing with malaria or typhoid. It might be something more sinister. Refer to an appropriate center where they can be able to do. And also learn to do. We want to encourage our colleagues, particularly those in the peripheral centers, in the communities, to learn to do the full blood count. That can give us a good diagnosis about or pre-diagnosis about leukemia. When you're able to do your full blood count, you see that the white cell count is very, very high, or is rising gradually. Then you have to know that something else is going on, and be able to refer to a hematologist to now look at those blood cells and do a bone marrow to actually verify or confirm if there's a leukemia going on. And if because the white cell is low, the person will present with cough. That's what we call opportunistic infection. Any infection that flies up because your white blood cell is not active, the immune system is not active. So any disease that flies about, the person will catch it. If it's cough, it's anyone that fly about you. Bear in mind that the environment is not sterile. Okay, so there's always one bacteria or virus flying around. But if our immune system is strong enough, we're able to withstand those infections. But when it is down, like in case of leukemia, acute leukemia, myeloid leukemia, you have that person is predisposed to catching these infections. So in that way, you say yes, there may be some similarity in their symptoms. And again, leukemia is one of those conditions which have been told that do not do well with COVID. Okay, because of their immune system is already down. So if they not catch COVID, it becomes very, very disastrous. It becomes very, very bad for the patient. And that's why we advise, if you have leukemia, you better take care of yourself. Avoid crowd. Stay at home. During the heat of the COVID, we advise our patients who are blood cancer patients to remain at home. Don't come to the hospital. Call us on phone if there's anything. So we can arrange, if we need to give you chemotherapy or anything, we can arrange how to do that, so that at least you don't get exposed to being infected with COVID. Well, for leukemias and all cancers generally, what the treatment options are that of chemotherapy. And chemotherapy is a combination of very strong medications that are toxic to the cells of the body. So they destroy the cell, because we're talking about these are cells which are multiplying excessively. So you need cells which will break them and kill those cells, and also stop them from proliferating. So that's why you use a combination chemotherapy. And the phase are called what we call induction phase, where we use about 3 or 4 or more of those drugs over a period. It's a cyclical treatment, but over 21 days cycle. Some are given for only 1 day, some are given for 2 days, some are given for 5 days, and so on and so forth. I was given every 8 days to 14 days. So the induction phase is done just to wipe out, to clear off every of the cancer cells. And then after we now go what we call, when we now check and see if it have reduced. Because when we're talking about leukemia, we're talking about more than 20% of blast cells. There's 30% of blast cells either in the blood or bone marrow. And when we repeat the bone marrow and see whether the blast cells are still there, if they are still above 5%, then we repeat the induction. But if they are gone less than 5%, we now say very good. Patient has been to remission, and now go what we call consolidation. And after the consolidation, we now call what we call maintenance. Maintenance is because, like I said, if cancers is like when you are in a war, you're going to a war, okay, and you're fighting your enemy, throwing bombs and everything, you have artillery on your enemy. So by the time you have wiped about 90% of them, the remaining 10% remaining, all of them are not dead. They keep scattering, running away or hiding, looking for where to hide. And when you withdraw, when you stop, you're not finding them again, withdraw. What they do? They will come out, regroup, even recruit more members to fight you again. And that's exactly what happens in cancer, or blood cancer or cancer generally. So once you have achieved your remission, you will have to you don't have to go and sleep. You keep on regularly giving pulsatile chemotherapy to maintain that baseline. And then again, in an environment where it's feasible, stem cell transplant is the option. Okay? And when you have stem transplant, it does well. Those who are going to do well on it, because then they'll clear away those blast cells and they replace with a new hematopoietic stem cell. And those who have been tend to live longer. During our World Cancer Day activity, one of our resource persons was a gentleman from US who has survived 2 acute leukemias. And the first one was over 20 years ago, and he has been disease-free for about 20 years, which means it's almost like a cure. So it is, but unfortunately, in Nigeria here, we don't have any public center that is actually doing a transplant. The irony and the anointing is it's not a rocket science, something simple which we can do, but the facility is not available. Want to give kudos to one of my senior colleagues, Professor Baswaye in Benin, who has pioneered transplant medicine in Nigeria. So he is actually going to doing transplant. He has done for sickle cell, now he's going to cancer. He has done some cancer for some blood cancers, and have done very well. And he's doing it in a private center because the public center are not prepared to do this yet. Side effect, one of them is that, of course, the chemotherapy we use to treat the disease also, while killing the cells, the cancer cells, also destroys even the good cells. Okay? So one of the things you have, if people are having diarrhea because the GI cells are being destroyed, they don't have diarrhea. Even the bone marrow is also suppressed because it also destroys the bone marrow itself. So worsening the condition, you have to continue to transfuse. Okay? And again, it can also affect the reproductive system. Okay? So it can destroy the gonad, the reproductive system, that the person may not become able to reproduce again. And so before we give chemotherapy, we always counsel the patient, particularly those who are still younger, who wants to have babies in the future. So they are actually counseled and let them know that these are what you are going to get, what you are going to experience. You might have this. Those who can, and where the centers where it is possible, we do what we call sperm banking or egg bank. So their eggs or sperms are harvested and stored. Okay? So that when they now want to have babies, those eggs or sperm can be brought out and used now to make babies for them. So those are one of them. And also, we also found that even though those drugs treat cancers, but in the long run, they can also cause cancers too. Okay? So it's almost like a two-edged sword. But the important thing is the person is that if you don't treat now, the person is going to die. So the best thing is actually to treat, and then because this is not an absolute, that is more likely to happen. So we still have to go ahead and treat. Yeah, like I just mentioned about somebody who has survived acute myeloid leukemia, the dreaded one we're talking about here, for over 20 years. So if somebody has lived for 20 years with a disease, that's almost like a cure. So, um, yeah, there's a cancer that can be cured, but acute leukemia, it remains in the system, okay? But it is suppressed. So you can live your healthy life, you can live your normal life, go about and do your work. The guy I'm talking about is an ex-military man, and he's an IT person now. He's going about giving lectures and working. So you won't even know that he has a blood cancer. So it's almost as good as cure. Yes. Well, it depends on I think it's relative. It's quite relative, depending on where you are and what is available to you. But what I have to say is that acute leukemia is treatable. Okay, it can be dealt with if appropriate facilities are available. So it depends on where you are. Somebody who's living in the village, who may not have opportunity of even knowing that he has leukemia, the person may die within 3 months. Okay, so it depends. But in a situation where you are able to have access to a hematologist, okay, it have been said that when you treat with really old chemotherapy, the 5-year survival rate is about, depending on the age, those who are elderly is about 25%. Those who are much younger is almost about 40 or 50% who can live up above 5 years. Okay, but when you now have a transplant done, of course, like I said, you can live above 20 years, 25 years. Okay, so it depends, and it's relative to your circumstances, where you are, and how what is available to you. What we always will keep appealing, we can do transplant in Nigeria. But first and foremost, the most important thing is creating awareness, which is why we are here, is to create awareness. People may be able to know. And that awareness is very, very important in the environment, because many people don't even know, are not even aware there's something called blood cancer. So they keep treating for malaria and typhoid. So not even go to hospital. And before they die, they say it's witch, or somebody sucking their blood somewhere. Okay? But that is not true. If they come to hospital, we're able to diagnose them. People need to know, being able to come to hospital. So that awareness we are creating, so people know that these are conditions and they are manageable. Okay? And we also want to appeal to government to support. Let the diagnosis and the management of cancers, like leukemias, be part of NHIS. And people should be encouraged to register, even those who are working for government, should be able to register for community. There should be community registration for NHIS, so that people can have access. Because that's what we know the most critical thing in our environment here. People are not able to pay for their diagnosis or treatment. Okay? Most times when you diagnose, they say, this is not hospital treatment. Then they pack that bag and go away, and eventually die. So we need to encourage people to come to hospital. We need to encourage government to subsidize treatment and provide diagnostic facilities that we need to treat and to diagnose. And like what I started before, with transplant, the patient tend to live a normal, happy life. And we can do it here in Nigeria. Professor Basoy has shown that it's possible, that we can do it in Nigeria. All we need is for government to give us, at least, if we can have one transplant center in one geopolitical zone, in all the geopolitical zones, we can have 6. We can have more. And then encourage our big men, those who have, those who have made money, what they embezzled it to, or however they made the money, to also invest in health. Health is also lucrative. It can be a business. So you can also invest, those who can afford it. Many of our people go to India. Before people say, I have to refer about 2 patients to India 2 years ago for this myeloid leukemia. Many travel to India almost on daily basis because of these conditions. They go there to go and do transplant, or South Africa. We can do that and retain this money now in our country. So if every geopolitical zone can have a cancer treatment center and can do a transplant, it will go a long way to improving and making us a country to be proud of. And let also our big men, those who have made some good money, should also think of investing and giving back to the society by investing by building at least a transplant center or a diagnosis center where cancer can, because that is a major problem actually diagnosing. What we can do mainly here is just bone marrow and look at morphology. There are more that can be done to actually characterize the type of leukemia the person have. I know the type of treatment to give, but because we cannot characterize those cells, we will just see them and call them acute myeloid leukemia, ALL, CML, and then give one omnibus treatment for all of them. But if they are actually characterized to their basic genetic markers, we can be able to find specific treatment that will be less harmful to the body, that will be less toxic to the body. So it's an appeal to government to come to the aid and invest more on health and give us transplant center. We don't have anyone. UBTA started. That's the UBTA started. That's where Bible started before it started. I was there for the first transplant for sickle cell patients. But unfortunately, the Nigerian factor killed that project. Now, the transplant center is there, overgrown with weeds. Nothing is happening there. And it doesn't take too much to do that. The money we are here, people are investing every day, can build a good transplant center for us. And we can do it. Nigerians are, and we have good experts in Nigeria who can do this. So we are appealing to government to at least give us opportunity to actually practice and enjoy our profession.
Symptoms of acute myeloid leukemia could be mistaken for malaria or typhoid. So, ensure you visit the hospital for regular checkup, as early detection is key. Thank you very much for watching this week's episode of the program Health is Wealth. See you same time next week. Goodbye.